Out podcast. I'm your host, Dr. Jackie Jewett, and today we're going to be talking about what audiology is, where you can practice as an audiologist, where you can grow the field, and we're going to get to it all. So, who are audiologists? What do we do? What is the day-to-day life of an audiologist? Well, let's start with the first one. What is an audiologist? And I'm going to read this straight from the website. So, audiologists are experts who can help prevent, diagnose, and treat hearing imbalance disorders of people of all ages. And so, when you think about that, hearing imbalance, they go hand in hand. Our innermost part of our ear holds our vestibular system as well as another part of our ear where we can find like permanent types of hearing loss and things like that. So hearing imbalance, they go together hand in hand. And so as an audiologist, you can treat, you can understand, you can diagnose where hearing loss is, you can diagnose vestibular disorders, and then kind of come up with a plan on how to treat that disorder or treat the hearing loss. So what do audiologists do? So as far as hearing loss, we can evaluate hearing from, again, they say people of all ages. So literally we can test a baby that is fresh out the womb and understand where they are hearing and how that pathway works. So we won't necessarily know behaviorally from an infant until they get older to be able to give us different clues and that they're hearing. And so when they're babies, we do different types of hearing tests, such as auditory brainstem response testing. And so what that is, it's more of a, in simple terms, it's more of a test to see how sound, when we put it into their ear, travels up to the brain essentially. And so we do that, we put electrodes on their head, behind their ears, and we're measuring how this sound is traveling, because electrical impulses that are going through our brain that we're picking up on these electrodes to tell us, oh yep, they're hearing it down to this very soft level. Babies are required to have their hearing screened within the first month of life, and so with that it gives us an idea of, can they hear, or do we need a little bit more further testing? And I think that's going to be something that I'll definitely touch on again later in other episodes. But this one, I just want you to know that those are some of the ways that we test infants. And then as they get older, at about 6 or 7 months of age, babies have that trunk support. So they're able to sit up on their parent's lap and kind of look for sound when we present them at a variable rate. In a sound-filled setting. So what that means is that we're presenting them through speakers, and we're trying to train the kid that, and you hear the sound over here and you see the toy light up, you're going to look. And we do that a couple of times at high levels that we expect the child to be able to hear at, and then we record their responses as we turn it down and down and down. That is my favorite type of testing. I love testing little ones because it's kind of funny to see, because although they can't say yes, I heard it, or raise their hand or anything like that, immediately when a kid hears something, when a little baby hears something and they are hearing within that normal range, they're gonna instantly look. And if you train them well enough at the beginning, they're gonna start to anticipate. So as a pediatric audiologist, you have to be ready to switch it up, or when you can anticipate when he's gonna look again or when she's gonna look again. And so you switch it up and you put it to the other side, because they'll start drifting this way and you play it over here and they immediately go. They heard it. So that's one of my favorite things to do as someone who has been pediatric trained in my externship. I love working with kids, and that was my favorite part, was that visual reinforcement of a type of a hearing test. And then we also have hearing tests that you can kind of think of as that standard hearing test, where raise your hand when you hear the beep, and we play the sounds in the different ears, and we work through the different frequencies to get a picture of how you're actually hearing. So those are different things that you can do as an audiologist. There are other ways to test hearing, but we'll just kind of leave it at that, the basics for today. And then also we are able to do different balance testing. So Personally, I'm not your vestibular girl, but I know somebody who is. And so if we ever want to kind of dive more deeply into vestibular and how that works and just kind of the ins and outs of being a vestibular audiologist, I will happily bring someone else on to talk about that, because this is not for me. And then also, so another part of what we do, we can prevent, diagnose, but then we can also treat hearing loss. And so treating hearing loss varies dramatically, because every person's ears are different, every person's hearing is different. We may have a case that may be similar, but what each person is looking for out of treatment can be different. And so we have different options, and depending on the level of hearing loss or the amount of hearing loss that someone is experiencing, we are able to recommend different types of treatment options, whether that be a traditional hearing aid that some of you may be aware of, or it may be something a little bit more like a cochlear implant if their hearing loss warrants that. And again, we can walk through the different types of hearing loss, the severities, and then kind of look at some things that would maybe warrant different types of amplification. There's also bone conduction hearing devices, and so that's for someone who may not have an external ear that we see, you know. There may be different syndromes or abnormalities or malformations that happen during birth that somebody may be born without an external ear that we see, but everything inside is working just fine, and they just need that little extra boost from a bone conduction device rather than just hearing acoustically like we do. So that's how we can do like the treatment of that. Vestibular, again, I will leave that to the vestibular audiologist. I am not in any place to go down that, because honestly, again, it's just not my favorite. So yeah, we can also talk about prevention. So noise-induced hearing loss is something that is very preventable. If you are wearing hearing protection, if you are doing the things that when you know you're going to be around loud environments or working with loud machines, you're wearing that protection to preserve your hearing. Because I always told patients and tell them still, once your hearing's gone, it's gone. You're never going to have that natural hearing again if you lose it. So noise-induced hearing loss is very preventable if you take the steps to make sure that you are wearing appropriate protection in those environments. So those are just some of the things that audiologists do, and some of the things that we can offer to our patients. Where can audiologists work? Audiology is a vast profession. So we can work in schools, we can work in hospitals, we can work in private practices, we can work in ENT or otolaryngologist offices, we can work in colleges and universities, bringing up the next people. And I'm going to say this here, we can work on social media. We can be very versatile in our work, because one, it is a very new profession when you compare it to pharmacy or nursing and things of that nature. Audiology is a very new field when it comes to allied health professions. And so we have a lot of wiggle room, we have a lot of growing to do, but we also have a lot that we can do where we are currently. And so working in these different places, I've had the experience of working in a lot of different settings as far as my clinical placements. And so at my first year in my program, we were put in our school clinic. And so that was just kind of where you got the flow of how clinic works. You got comfortable with working with patients. We were seeing real patients with real hearing loss, with real concerns. And so that was just a place that we had to be able to grow to where we are now. And then I worked at the VA in Illinois. I have worked at private practices, many private practices. I worked in a ENT setting. That's where I got the most of my training at. And then as far as the types of population that I've worked with, earlier in my career, earlier in my education, I worked with a lot of adults, and I think that starting out with adults is the way to go, just because you're still learning, and they understand that, you know, you're a student, that you're learning, and that you have things that you have to figure out before you can really get to the point where you're comfortable. And then working with kids is a whole nother ballpark. I absolutely loved it, 'cause it was like a challenge. Like, what is this kid gonna, you know, try to do? What is this 13-year-old girl who says that she lost her hearing completely in one ear just overnight? What is she gonna do? Not saying that it doesn't happen. It does, but if you're an audiologist, you know what I'm talking about. So I really enjoy working with pediatric populations, and just to me it felt like I was able to, and still feels like I'm able to make a difference in their lives sooner rather than later in life. If I can be the person that, you know, we see the hearing loss at birth, and family doesn't know what to do, I can provide them with as many resources as I have, so that they feel comfortable making the decisions that they need to make for their child. So again, audiologists can work in a lot of different settings, and I think that we are at a point where our profession has the opportunity to take it to the next level. And so with how much technology and things that we have right now at our fingertips, I think that, again, this podcast is going to be the launching point for that next step in this profession. I know that there's an audiologist who I haven't quite had the pleasure of meeting just yet. We're going to meet. But she even designed her own headphones. So she has some over-the-ear ones, I think, that she's dropping soon. And then she has like earbuds. I'm pretty sure. I'm not 100% sure on that one, but I know she has some over-the-ear ones that she's going to be releasing soon. They're called drums. I guess I could tag her down in the comments below, maybe. So I mean, audiology is it's a huge spectrum and array of things that we can do. I just hope that we see this opportunity now and we take it to the next level, because I know that we're going to be able to help a lot more people if we are working towards growing this field. Okay. I have worked in a lot of different settings. I will say that my favorite has been working in an ENT setting. So my last year, my 4th year externship was at an ENT practice, and it was amazing. Like it was stressful, but it was like the good type of stressful, because you're like constantly going. I'm the type of person that when I'm at work, I need to be doing something. Otherwise I get bored and I get tired, and I'm like, okay, I'm ready to go. But at an ENT practice, and especially if you get in a busy one, you will be going constantly. If you're not, seeing the audios, the people that are only coming to see audiology, then you're taking the ENT charts as they drop. So ENT needs you to do a hearing test real quick on a baby, or a hearing test real quick on a 13-year-old, again, who said that she lost her hearing, but can hear you when you whisper behind her. So, it's just a lot of different things that you get to see in an ENT setting, and then also just like working with other professionals. And so that was my biggest thing, is that I didn't want to only work with audiologists. I want to be able to say that I can work with nurse practitioners. I want to say that I can work with physician's assistants. I want to say I can work with the physicians. And then on the business side, I want to say that I was able to work with the front desk staff, and they were able to understand when I say, hey, I need a 2-tester audio for this kid. They knew what I was talking about, because we were in a setting where we were able to work with each other and do the best for our patients. So ENT was my favorite by far. I really did enjoy it. And so that'll probably be where I'm heading still next, is to another ENT setting. But right now I'm taking the time to really put in the work so that this field can grow and it can become all that I know that it's going to be. The last thing I want to talk about, I really just want to encourage those that may be thinking about going into audiology. Maybe you're currently in an undergrad program and you're like, I don't know what I want to do with my life, which is fine. You do not need to know what you want to do with your life. quite frankly, I still don't know what I want to do with my life. Here I am. So I just hope that this kind of will reach you and you will hear me out when I say just give it a shot. If you don't know what you want to do, I would implore you, I would encourage you to just reach out, see if you can find an audiologist in your area, see if you can reach out to me. My information is linked on my page here. You can reach out on Instagram. Just try to connect with someone who is in the profession, who can tell you their story, who can tell you what they do, what they enjoy, and just see if that's something that would spark your interest. Because like I said, audiology is a huge, like, it's so vast, and like you could go from one audiologist who just does not like working with kids but is phenomenal with vestibular testing to a person like me who I love working with kids. I'm good at it. I can get on their level. I can really get to a kid and make sure that I'm getting the valid and reliable responses that I know I can get from them. But vestibular, I'm not touching it. Like I know when to refer, and that's where I stand. So that's when I'm saying that audiology is very vast. You can do a lot with this degree. Within the profession, again, I started this podcast. I did not see a lot of things on like social media or how I could, reach out to audiologists. Now again, I was not very proactive, but I want it to be that if you are someone who is timid, who is shy to reach out, that you have this platform which tells you as much as I can, and then maybe you can make the decision for yourself. So I would just say if you're in high school, if you're in an undergraduate program and you're like, I just don't know what to do with my life, I would encourage you to find someone within the field of audiology. If your school that you're currently at has a undergraduate program in communication sciences disorders, or you have like speech, language, and hearing sciences like I majored in at Purdue, you can go and just ask them to shadow. Just say, can I shadow? Just wear some business casual clothing, sit in on a couple appointments and see if you like it. If you hate it, cool, at least you tried it. But if you like it, I think that you will fall so deeply in love with it and in love with wanting to help people. And so that's how I kind of got into it. Again, I've had a little bit of exposure as far as having a deaf cousin, but that I never went to like audiology appointments with her, so I didn't even know that an audiologist existed until I got to Purdue and was in that first class where they introduced audiology to us. And so I would just encourage you to look into it and see if you like it. And then you can always reach out to me. I am always open to talk to people. Emailing is fine. I will probably email you back and say, hey, let's set up a Zoom so that we can talk, because I feel like you can really get to what people are trying to ask when you just talk to them rather than going through email. But if email is your thing, I'll email you. That's fine. So that is all, folks, for today's episode. I thank you for tuning in today and just watching and just sticking beside me. This is something very new for me and something that I just think, again, is going to grow this profession beyond what we can ever imagine. And so with that, I just want to ask you, thank you for liking and subscribing and sharing with those that you think this will benefit, this will touch, and that if you have any questions, comments, concerns, keep it cute in the comments below. I'll definitely plan to read through those and just reach out. And if you have any suggestions of what you want to see, who you want to see, anything like that related to audiology and the audiology lifestyle, please don't hesitate to reach out. But that is all, folks. Thank you for coming in today. Hear me out, because we got a lot to talk about.